morning, this is All India Radio, Kohima. I am Nabin Pradhan with the morning news. A record 51,255 recoveries were registered in the country yesterday. This is the highest number of recoveries in a single day since the outbreak of the pandemic in the country. With this, the recovery rate has improved to 65.43%. The case fatality rate has further declined to 2.13%. The Health and Family Welfare Ministry has said a total of 11,45,629 people have recovered from COVID-19 in the country so far. Altogether, 54,735 new cases of coronavirus were reported, taking the total number of cases to 17,50,723. Presently, the total number of active corona cases in the country is 5,67,730, while the nationwide death toll is 37,364. Nagaland Minister of Health and Family Welfare S. Pangnyupom has said that the most important measures to prevent and control COVID-19 is to stay healthy by not getting infected and prevent others as well from getting infected. In a press statement, the minister, while saying that the coronavirus is here to stay, appealed to all to adopt safe practices and adhere with the advisories issued by the state government from time to time. He said that it is the individual's responsibility to stay safe and healthy. As of yesterday, Nagaland has 1,935 confirmed cases, out of which 1,277 are active cases, 648 recovered and 4 deaths. A total of 946 confirmed cases are among the returnees, 692 from the armed forces, 139 are from frontline workers, 126 are traced contacts and 32 others. Pom said that vigorous contact tracing is being carried out and in all positive cases the source of infection has been traced. In this, the minister asserted that there is no community transmission in the state as of now, acknowledging all the frontline workers for putting in their selfless service in protecting the lives of the people. The minister said 542 doctors, 2,065 nurses and various supporting staff including contractual manpower under the department is involved in this fight against the COVID-19 pandemic and delivery of essential health services covering 13 COVID-19 hospitals, 12 COVID care centers, 261 designated quarantine centers, 21 CHCs, 127 PHCs, 396 SCs, 2 TB and CD COVID hospitals and 1 mental health hospital. The World Health Organization (WHO) has warned that the coronavirus pandemic is likely to be lengthy. The statement comes after an emergency committee of WHO met to evaluate the crisis 6 months after sounding the international alarm. The committee also warned of the risk response fatigue given the socio-economic pressure on countries. The committee highlighted the importance of sustained community, national, regional and global response efforts. The committee urged the WHO to provide nuanced and pragmatic guidance on COVID-19 reactions to reduce the risk of response fatigue in the context of socio-economic pressures. Mizoram reported the highest single-day spike of COVID-19 with 55 people being infected with the virus, taking the state's caseload to 468 yesterday. It has surpassed the July 10 record in which 51 people had tested positive for COVID-19. The fresh infections have pushed the active cases to 215, while 253 people have recovered. The recovery rate in Mizoram is estimated at 54%. The All Nagaland College Students' Union ANGSU yesterday commemorated its 41st Foundation Day through Virtual Connect due to the ongoing COVID-19 pandemic. Addressing the fraternity of the colleges and well-wishers, ANGSU President Vimeyeko Vitso, while conveying greetings, paid tributes and respect to the pioneers and former leaders of the union. He also sought the continued support of ANGSU units, college authorities, faculties and all well-wishers in its future endeavors. Vitso asserted that completion of 41 years would fortify ANGSU's commitment towards the cause and welfare of the students' community. He also called upon for a collective effort in making Nagaland an educational hub. ANGSU Media Cell informed that an electronic bulletin was also released on the occasion, which was attributed to the pioneers and former leaders of the union. And that's all the news we have for you this morning. Have a nice day.